Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Dr. Heidi, I think one of the things that everyone's kind of curious about is what are patients talking about when they're in your operatory or when they're in your presence? You know, what are the hot topics or the buzzwords that they have questions about? I think a lot of people would like to know that.
Oh, sure. One of the things we always, get questioned about is bleaching. I guess number one, is it safe? Number two, why does it make my teeth sensitive? And basically, yes, it is a safe product. When I go through and talk to patients about bleaching, I usually explain that there's kind of three main tiers of bleaching. And I often will encourage them to actually start with, first we make sure that, that their teeth are, something that can be bleached. If you have crowns or fillings that they don't bleach, so we talk about that. But we'll talk about, just the over-the-counter bleaching for some people is really quite effective. And if it's the least expensive, I'd say start there. And then we talk about, we actually in our office have the Opal Go, which is sort of the second tier. And then we talk about, bleaching trays as being the third tier. And we kind of talk about the difference, bleaching. The Opal Go is sort of, you buy a packet that is good for, I think it's 10 days. And we talk about that sensitivity is expected, and you can actually spread them out. Instead of doing them every day, you can do them every other day. And that way you tend to get less sensitivity. And then the trays are, I usually gear them towards my patients that tend to do things that stain their teeth, coffee, tea, pop, red wine, stuff like that. Things that are, if there's somebody who does those things a lot, then they're probably a better candidate for those bleaching trays. So that's definitely something I talk about on a daily basis. So one of the things I guess that's more interesting, that's a little newer, is the charcoal toothpaste. I get those questions quite a bit. And charcoal toothpaste is actually a really interesting product. The concept behind it is sort of rooted in medicine. The idea behind charcoal toothpaste is really that it should absorb toxins, which that's sort of a generic word, toxins, but because they use it, like if you have certain things that you have ingested and you go to the emergency room, they'll give you charcoal or activated charcoal. And so the idea is that the toothpaste will absorb the same things that that it does in your stomach, and your mouth isn't really the same as your stomach, so it really doesn't it doesn't translate well into your mouth. And also charcoal tends to be quite abrasive, so I've actually had to do some fillings on a patient or two that has kind of scrubbed their teeth down to the dentin level because they use the charcoal toothpaste too much. So I generally don't recommend the charcoal toothpaste.
Okay.
Another one, actually, one that I think is really interesting is, it's sort of an old remedy that people will ask me about, oil pulling. Have you heard of that one,
No,
Deborah?
what is that? I have not heard of that.
I know it sounds really weird. It's just switching your mouth with oil. And the interesting thing to me is it's actually rooted in like the Ayurvedic texts, which are from India from like 600 AD.
Wow.
And so, so it's a really interesting concept, and people like to point to that and be like, see, it's this ancient medicine that, that really imparts health. But in my mind, it was the best thing they had at 600 AD. So it wasn't necessarily that it's, we have toothbrushes now, and we have, other things. And if you do the oil pulling, and I should explain, oil pulling is you literally take oil and swish your mouth with it. And like they now say coconut oil, but
Okay.
like the people that are recommending it, yeah. But actually, if you look back to the original recommendations in the Ayurvedic texts, it's actually not coconut oil. But they, in order to make it, work officially, you have to swish for 15 to 20 minutes. Oof. And that's dedication. I'm like,
that is.
I could have brushed my teeth and flossed and been to sleep by that point. So I mean, I get the desire for like the all natural, approaches, but that's a long time. And I mean, like, if you swish your mouth with anything for 15 to 20 minutes, it's bound to like, maybe have a little bit of a health benefit.
Right.
But it isn't, I mean, brushing your teeth is still what I would recommend is the most, important way to clean your teeth, and flossing and water picking and all those other things. But anyway, yeah, so that's kind of a fun one that, if somebody asked me about it, I get to explain a little bit. Anyway.
Interesting. All right. I always like to ask dentists that question because I get a variety of answers. And
Oh
sometimes
yeah, yeah.
it's just very interesting what patients show up with. I have to be like,
Well, and actually, we don't see it anymore, but we used to get the question of like, I mean, is flossing actually effective? Because like
yes,
everybody's crossing their fingers that it's not effective, but
right.
it is effective.
It is.
Basically, if you have stuff on your teeth and it sits there, it's going to cause a cavity or it's going to
Yes.
cause gum irritation. So removing it is the answer, and you can't remove in between your teeth except by putting something in there too. So that's why
Yes.
flossing helps. Anyway.
Just out of curiosity, do you have patients who ask about the water pick, the new water flossing? Pe-
Oh yeah. Actually, I mean, if you look at the studies with water pick, I mean, I do feel like it's really effective. I mean, I'm still a traditional floss, and
Me
well, I
too.
use an electric brush, but yep. I'm still the traditional, but I mean, especially if somebody says, you know what, take flossing off the table because that's not going to happen. What else you got? I actually really do recommend that one because it is, I mean, it's a really great way. Now it's a little tricky because number one, you have to be really close to the sink because you get a lot of water. And
Correct.
number two, you do have to angle the toothbrush, in the right way in order to be able to get it to go in between your teeth. So there's a little bit of a learning curve there. But yeah, actually in certain cases, you can actually put like a medicament in it, like a mouth rinse, like an anti-gingivitis mouth rinse that will actually deliver a little bit of that medication in between your teeth. So it's actually, I mean, I do recommend it in certain cases. So
Interesting. All
yeah.
right. I just like to ask that.
Mm-hmm.
So let's switch gears here real quick. Let's talk about, obviously we're in the middle of this, pandemic with the coronavirus. I think it's
Mm-hmm.
important for us to talk about, what is Byron Dental doing to make sure that the patients are safe when they come into the practice, and making sure they come in healthy and making sure they leave healthy. I think that's an
Mm-hmm.
important piece to talk about. So let's chat about that.
Yeah, actually, as they were coming out with the new recommendations, I think I sent Lori, our office manager, I think I sent her like a 24-point email saying all the things that we were going to have to do differently in order to be able to, safely provide care for our patients. And so, I mean, like, so when you come in to our office right now, things do look a lot different. Um, Everybody well, all of the dentists, hygienists, assistants, pretty much everybody is always wearing a mask. So, I mean, that's a critical part of it. We actually, I feel a little bit bad because we probably annoy patients a little bit because we ask you screening questions the day before, and then we ask the same questions the day of your appointment because we have to make sure things haven't changed. We take your temperature when you first walk in. And actually, we're trying to not really have many people in our waiting room. So we've actually, I mean, on the hot days, we're trying to be accommodating too. But for the
Hmm.
most part, we've had patients actually stay in their car until we have them come in, and then we actually escort them through our building, and we take their temperature. We actually take your pulse oximeter, or pulse and oxygen levels to see where they're at. Then we bring you back and we have you actually swish with a type of mouth rinse that is meant to cut down on any viral load that might be in your mouth. And then, if you haven't brought a mask, we will have you wear a mask. We'll bring you a mask. And only when we do the swishing is when we first will have the mask off
Hmm.
in our office. And then, I mean, I am wearing, I wear my regular, coat But then on top of that, I'm wearing a gown that we launder separately, and each patient it gets their own gown. And then I have, okay, so so I have my N9, or I guess we're at a KN95 right now, KN95 mask, and another mask over top of that. And then I wear my loops and their goggles, and then I have a face shield. And so like
Whew.
it literally takes me like 4 minutes to put all my stuff on. So number one, we have a little bit longer appointments because we have to be able to like accommodate all that extra time, because I
Right.
mean like all of those things take time. And then number two, we have asked patients to maybe wear like an extra layer of clothing, because with all the things that we're wearing, we have to keep the temperature just a little bit cooler.
Yeah.
You have blankets if you forget, but yeah, I mean, like I think we're trying to keep it at 67 or something like that, and I know in the summer that's hard because it's 90 degrees outside, but in order for us to be able to wear all that equipment, we need to keep it a little cooler. And then, I mean, like actually, dentistry as a profession, I mean, we have been, very good about already controlling all of, I mean, like we do universal precautions and stuff like that. So
Correct.
a lot of the things were actually, I mean, like the sterilization of the instruments, this is a pretty easy virus to kill. So, I mean,
Mhm.
like we wipe things down, I mean, as we always have. But I mean, like the virus itself isn't a challenge from cleaning the instruments and, rooms type of challenge. It's more, how communicable it is. And so
Mhm.
trying to create barriers in there has been the most critical for us. So.
What have patients done in terms of a reaction to, or what reaction have you gotten from patients for all the increased safety measures that you've put into the practice?
In general, patients have been really receptive. They understand. I mean, we're really lucky. We work in a medical community where a lot of people are kind of dealing it with in their own jobs anyway. So, I mean, like when we ask them the questions that they have to ask at their own work, they get it. And I mean, there's probably been a little bit of frustration with, because we have to have our appointments longer and we have to have, I mean, like we basically are at half staff right now because we have to accommodate for all the social distancing. So we've had to cancel a patient appointments, and I felt really bad about that. But I think most people have understood that, while we want to see them, we also want to create a safe environment.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits that result in the personal and professional success of the dentist and his or her team.
This is Dr. Heidi Torgerson from Byron Dental Group. When you visit Byron Dental Group, your smile is our top priority. Our team is dedicated to helping you restore and preserve the natural beauty of your smile. If you're looking for a caring dental practice that puts your needs first, then contact us.
Dr. Heidi, let's go ahead and talk about one of the most important parts to the success of our dental practice, and that's our team. You've made
Mhm.
several references to it already. How important is that? And why don't you talk a little bit more about that?
Well, I can't stress how important having a good team around you is. I mean, number one, patients will often, I mean, like I'll, do everything I can to explain things and, give options and all that. But patients will invariably ask my assistant, ask my hygienist, ask the front desk person. There's a lot of different people that they probably want to hear from besides just me. And so number one, making sure that I am, giving treatment that they understand is really important. But then training them to be able to, talk to a patient. Like, I mean, we have brochures on, I mean, pretty much all of our main procedures, because I like to have, I mean, after, especially on bigger procedures, I like to actually have the assistant talk with the patient, because a lot of times they'll feel more comfortable with that. And the assistant can walk through, this is what to expect during a procedure. This is how many appointments you'd need. Sometimes they'll, this appointment we would get you numb, but this appointment you don't even end up getting numb. Because that's really critical. And so having a team that allows you to do that is really great. I think that was one of the things that I actually, when I first came out of dental school, didn't understand. Like, I tried to be everything, and it almost is, I don't want to say insulting to the team, but it doesn't let them do their best. And I've seen over the years, if I give especially my assistants the chance to talk with patients, or my hygienists a chance to talk with the patients, and let them explain. A lot of times, we get to the same point, and a patient will feel more comfortable. I mean, I will give my recommendations, and I'll try to give, any information that I can, but having a team that will also be able to do that is so critical. Another thing that I also didn't understand when I was coming out of dental school was how critical a great front desk and office manager is. They set up your schedule. They, are always looking, weeks and months ahead, versus I'm looking a couple days ahead.
Mm-hmm.
And so somebody, or well, a team up there that can really, have everything organized for you, because how you want your office to run, but I'm only one person, and I don't have, that isn't my strength. My strength is, more of doing the treatment. Their strength is creating, a good day, creating, patient expectations. Like, if I don't have, the ability to do treatment that day, but they were really having an issue, at least let's get them in, let's get them a chance to, maybe get some antibiotics, or, something to make them comfortable. And my front desk team is really good at being able to explain what is to be expected at an appointment that day.
Mm-hmm.
So.
Dr. Heidi, I would say that what you just described is a leadership 101. The ability to be able to delegate and put your people in places where they're gonna be the most successful, and letting them do that, and not hovering over them and saying, "Well, I think you did that wrong. No, and you
Yeah,
did that wrong," and because nobody likes that. And
yeah.
but I think you've taken the
And
opposite. You've taken the opposite approach to that.
yeah, and it's amazing, like, what you'll learn. I mean, because everybody comes from different backgrounds, and I learn things all the time of, different ways that people put things. And, sometimes that's more impactful than the way that I've been doing it. Because, I just haven't been explaining something, quite clearly enough. And so, yeah, letting somebody do what they do well is really great
Hmm.
for everybody.
And I think you've also done something else that a lot of dentists have a hard time with, and that's let go of your ego. Um,
That's critical in dentistry, yes.
you know, yes, the dentist is always right when it comes to, when it comes to doing anything clinical. We won't have a discussion about that on this podcast. But and I'm being funny, but I mean, to be able to then kind of let yourself go a little bit, and then empower the other people around you, and to let them do what they need to do, that's a huge piece to running a successful dental practice, especially for any dentist out there who's trying to be an owner. I think you'd agree with me.
Yeah, definitely.
That's great. The one last thing I'll say is, you talked about the front desk team. That's outstanding at our office, especially, Lori, who's the office manager. I think she's kind of our Tom Brady of our dental practice.
Yeah, she is. I will say, yeah, she has been so helpful. I mean, just a great resource. So I've really appreciated her.
She's the glue that kind of keeps everything together, and kind of helps make sure everybody's where they need to be. And I
Mm-hmm.
think that the patients love it, the staff love it, and it's really been reflected in how successful Byron Dental has been.
Mm-hmm. Yeah, we're very lucky.
Yeah, she's great. This has been wonderful. Dr. Heidi, thank you so much for being a guest on the Dental Breakdown Show.
You're welcome. Thank you for having me. This has been more fun than Disneyland.
Yes, that's what I like to hear. So, our listeners, if they'd like to find out more information about you and about Byron Dental, where can they go to find that information?
You could reach us at byrondental.net.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white and see you next time on the Dental Breakdown Show.